Good morning, student. Today we are going to start the part second in this chapter. So first we see after the internal structure of monocot stem, dicot stem, we must see the internal structure of the monocot stem. So see here that typical structure of monocot stem, that is mesh stem, shows the following anatomical details as epidermis, hypodermis, ground tissue and stele. So first we see the first point, that is the epidermis. It is outermost and made up of single layer of cells. The cells are small, compactly arranged, somewhat barrel shaped and parenchymatous. Externally, epidermal cells shows the deposition of chitin, sometimes stomata may be present. Then hypodermis, a few layers on the inner side of epidermis. It is typically sclerenchymatous. It is called hypodermis. The cells are compactly arranged without intercellular spaces. Ground tissue, it is parenchymatous. It lies below the hypodermis. The cells are thin-walled and with large intercellular spaces. There is no dermaction of general cortex, epidermis, pericycle, pith and medullary rays as seen in dicot stem. Hence the general cortex is monocot stem is known as a ground tissue. Then stele. The stele is actinostele type. In this type, the vascular bundles remains scattered in the ground tissue, so that the identity of stele is lost. Vascular bundles are conjoined, collateral and closed. Peripheral bundles are smaller and more crowded, while those towards central region are large, widely placed, but all of them have similar internal anatomy. Vascular bundles are oval shaped and are surrounded by sclerenchymatous bundle sheath. Then next point, that is xylem elements are arranged in Y-shaped. They are two internally placed metaxylem vessels with pitted thickenings. The protoxylem vessels may be one or two narrow and have spiral or annular thickenings. Below the protoxylem elements, there is a large water-filled cavity known as a lacinogenous cavity. It is produced by disintegration of lower protoxylem vessels and hence also named as protoxylem cavity. A few tracheids and xylem parenchyma lies around protoxylem vessels. Phloem patch is rather small and lies outside the xylem. It is composed of sieve tubes and companion cells. Phloem parenchyma is absent. Innermost phloem is epidermis. Innermost phloem is the most important part in this portion. Then after that we must see the difference between monocot and dicot stem. So see here that in this table, first we see the epidermis in relation to the epidermis which is present in monocot stem and dicot stem. Epidermis in monocot stem, cells are smaller with hairs, and in dicot stem, epidermal cells larger and with hairs. Then hypodermis in monocot stem is sclerenchymatous and hypodermis in dicot stem is cholenchymatous. Then in relation to their cortex, in monocot stem, cortex, endodermis, pericycle and medullary rays are absent and known as a ground tissue. In dicot stem, cortex, endodermis, pericycle and medullary rays are present. Cortex is several layered parenchymatous. Then in relation to their vascular bundles, in monocot stem, they are conjoined, collateral and closed with enlarged xylem. And in dicot stem, vascular bundles are conjoined, collateral and open with a enlarged xylem. Then in relation to their vascular bundle distribution, in monocot stem, vascular bundles are scattered in the ground tissue, and in dicot stem, vascular bundles are arranged in a ring. In monocot stem, phloem parenchyma absent and bundle sheath is present. In dicot stem, phloem parenchyma present and bundle sheath is absent. In monocot stem, it is absent. Secondary growth is absent due to absence of cambium. And in dicot stem, secondary growth is present due to the presence of cambium. Thank you.